important topic of COVID-19 and dementia. We're going to cover some basic information on both COVID-19 and dementia, but then also talk about how this whole situation is affecting those with dementia and their caregivers. I want to let you know I am recording the presentation today. Also, if you are only on the phone, I encourage you to have pencil and paper ready. We're going to be sharing some great resources, and I want you to be able to take down that information. Today's presenters are going to be Jim Shulman with the Tennessee Commission on Aging and Disability. I am also going to be presenting later. Then we have two more great presenters, Janice Wade-Whitehead with Alzheimer's Tennessee, as well as Don Bunn with the Alzheimer's Association. So Jim, if you'd like to go ahead and just give a brief welcome.
I am happy to, Sarah. I want to welcome everybody to the call, and see a lot of good people on here, including Dawn and Janice. So glad everybody's on. So my name again is Jim Shulman. I'm the Executive Director of the Tennessee Commission on Aging and Disability. We are a long-time state agency that is responsible for mainly dealing with older Tennesseans, and obviously very worried about lots of folks during this period of time. We worry about them anyway, but particularly during the COVID-19 pandemic, have a lot of things that we are responsible for. And that's what Sarah asked me to actually talk about today. So this is just going to be real quick. This is what the Tennessee Commission on Aging and Disability has been doing for the last several months. Basically, when we realized kind of what was happening in February and March, instead of quieting down, we actually started stepping up, because we realized that, particularly based upon the demographics that we had seen, the older population was going to be mainly at risk. And so we realized that people were going to be shut down, not coming out, and so we had to figure out how to deal with our programming. So particularly with food, which is the number one thing that we actually get the most money for from the federal government, we had to figure out a way to go from no longer having congregate meal sites like at senior centers, because the senior centers were going to have to close down, and so were the congregate meal sites, because you couldn't bring people together. So we had to go from a model that had both congregate meal sites and home delivered meals, parts of the program, to basically just home delivered or pickup sites. And so we quickly had to switch over to that from March. And basically, because the senior centers closed down fairly quickly, we had to do it very, very fast. We we were getting money from the federal government, so we knew that we were going to have to start producing more meals because more people were staying at home. So realizing that most of our current providers were going to be stressed, particularly our frozen food manufacturers, we quickly came up with the concept of using small independent businesses across the state, primarily through April and May, when they were being forced to shut down to basic restaurant traffic, but they were open for serving meals, either drive-in or takeout. We contracted with 90 small businesses across the state, using them to provide our meals for seniors. So we did it through a number of different ways. Seniors could either come by and pick them up, or we could put them at a drop-off site, or we got the restaurants to deliver them ourselves. We were able, because of that, to double our capacity in terms of the number of meals across the state. It was pretty remarkable. A lot of credit goes to our staff for doing it and working with it, along with our area agencies on aging disability. But it simply made sense. If we needed the meals and we needed increased capacity, and they needed the business, and so we simply used our federal funds, a lot of our federal funds, to actually engage with the small businesses to get more and more meals out to seniors that needed it. It became more of a kind of a nationally recognized program. We had a number of states contact us and follow our models. So it was utilized all over the country in many ways, and we were pleased about that. The second thing I'll tell you is that our responsibility is to take care of people. So we were really very much worried about older Tennesseans, folks with dementia, folks with Alzheimer's, everybody else that we were serving. We have a program called Options, which takes homemaker and personal care services on a limited basis into people's homes. Obviously, that became more of a challenge. But the challenge was that program is designed to keep people in their homes and keep them out of facilities where we didn't want them to go. So working with our providers, working with our regional folks, we were able to continue to do that with safeguards in place. We continue to keep up with our I&A line, which is called our Information and Assistance line. I'll give you the number here in just a second. But that became more important for people looking for resources when they were kind of stuck at home. And then we created a new program. It was actually a program that Dara Elliott, who is going to be the next speaker, who just talked to you a minute ago, came up with, and that was called Care Through Conversation. It's a kind of remake of our telephone reassurance program, where you call in and check on older folks who are at home and just make sure they're okay. You call them once a week, call them once a day, depends on what they want. We quickly came up with a volunteer program, and so the idea was to try to connect those people to make sure that we were listening and we were outreaching if we needed to individuals. Our existing programs, we have a number of them. We have an ombudsman program that goes in the nursing homes and assisted living and advocates on behalf of people in those facilities. We had to pull them back out to protect both the residents in those facilities and our folks as well. They do most of it by phone. If there's an emergency, they certainly can go in. But we had to pull that program back. The public guardian program, where we take care of individuals who no longer take care of themselves. Most of those folks are in nursing homes. We had to do more of that work by phone. CREVA, which is a program for people who have been abused, we did that by phone. The SHIP program, which is Medicare counseling, we couldn't get across the table from people. We have to do that by phone. Family caregivers were allowed to continue, but much more careful. So a lot of our programs, basically everything is still functioning, but in a safe way, the safest way we can figure out how to do it, making sure we feed people and take care of them as well. So our programs are still up and running. If you need help, if you know of folks that need help, you certainly have some really good people on the line that you can certainly reach out to as well. But I'll give you our number. It's 1-866-836-6678. That's 1-866-836-6678. That's our information and assistance line. If you can't remember anything else, you can't find us at the Tennessee Commission on Aging, and you know of people that need help or need resources, use that number and call. Okay, so we are up and functioning. Our programs are up and running, and we are doing our best to make sure that we protect and take care of the older Tennesseans across the state. Sarah, I'll turn it back to you.
Thank you so much, Jim. And if you all didn't catch that number, I'll be sharing it again later because we want to make sure that that's something that you're able to take down. All right, so as I said, my name is Dara Elliott. I am the Tennessee Dementia Services Coordinator with the Commission on Aging and Disability for Tennessee. So I handle pretty much everything dementia related that comes through our office. So dementia is caused by the damage or loss of nerve cells within the brain, and we know that that causes memory loss and other symptoms that interfere with daily activities. Dementia itself is really a broad term, or sometimes called an umbrella term, that can encompass several types of illnesses or diseases. Alzheimer's disease is the most common type of dementia, which is why we often hear Alzheimer's and dementia used interchangeably, but Alzheimer's is a type of dementia. Currently in Tennessee, we know that over 120,000 older Tennesseans have dementia, and most of those people, so 81% of those people, are still living in the community. They're not in a nursing home or assisted living or anything like that. They're still living at home or maybe with family members. We also know that there are over 440,000 caregivers of those people living with dementia. So COVID-19, we've all heard most of this by now, but we know that the main symptoms include cough, shortness of breath, and fever. There are a lot more symptoms now that you can definitely look up, but those are still the three main ones. And we also know that symptoms start to appear 2 to 14 days after the exposure. The Tennessee Department of Health actually has a public information number that functions 7 days a week. It's 10 to 8 on Monday through Friday, and then 10 to 4 Saturday and Sunday. That number, you can call at any time. You can find testing centers in your area, ask questions about maybe symptoms you're having or a situation that you've come into contact with. So that number is there for you. That number is 77857-2945. So any general COVID-19 information that you would like to know for the state of Tennessee, you can just give them a call. These numbers I pulled on Friday related to the actual cases in Tennessee, so I know it's a little bit, or maybe a lot higher today. We know that 59,000 people, over 59,000 people had confirmed COVID-19 cases in Tennessee. About 35,000 of those had recovered, and unfortunately 723 fatalities. Again, those were the numbers for Friday, so it would be a little bit different as of today. So we are thankful in knowing that dementia itself does not increase your risk for getting COVID-19. However, it's important to recognize that someone with dementia may have other risk factors that can increase your risk for severe complications of COVID-19. So we hear a lot about older adults being asked to stay home because we know that the older you are, the more likely you are to have those severe complications or be hospitalized due to COVID-19. So even though we know dementia itself does not increase any type of risk, it's important to be aware of your other risk factors. If a person with dementia does get COVID-19, in addition to the regular symptoms that we just talked about or complications, it's also going to affect the dementia itself. So you can see increased delirium, sleep-wake cycle disturbances, anxiety, irritability, and then also isolation. So whether you do have to be hospitalized or you're staying at home, you're obviously going to be kind of self-quarantined as much as you can, and your routine is going to be disrupted. And so you are going to see those other symptoms like the anxiety and irritability come up. So even for people who do not actually get COVID-19 or know someone who has COVID-19, we know that there are a lot of environmental impacts going on just with things closing down, you're being asked to wear masks, things like that, that are having an impact on persons with dementia and their caregivers. So for persons with dementia who are at home still, so we know that the majority are, they're going to be experiencing excessive stress, or they may not fully understand what's going on, why they're being asked to stay home, why you're being asked to wear a mask. There also could be changes in home care arrangements. So maybe the decision has been made that you don't want to have a home health aide come in because you don't want to have that additional person or additional risk, associated with that person coming in. So that is going to be a change that's going to be difficult to adjust to. Also, unscheduled home life can be a challenge. So if someone is used to going to a respite at a church or an adult day center or something like that, and they're no longer able to go, you're going to have a lot more time at home, which can lead to boredom or restlessness, again, irritability and anxiety. also at the same time, you're still going to have that declining memory and comprehension or deterioration of existing problems. So I think it's important, that while a lot of things do seem to be on hold right now, we know that medical conditions and dementia itself is just going to continue despite everything else. For persons with dementia in long-term care facilities, there are some additional factors that can place stress and increase symptoms. The main one that, we've heard of reduced interactions with caregivers. So if you're used to having someone come visit you every day and then they're not coming anymore, that can be really confusing. And it can really affect the, again, anxiety and irritability and things like that for individuals in long-term care facilities in general, but especially for persons with dementia. And that, again, is going to lead to restlessness, maybe apathy or withdrawal. You're not able to do group activities that you would normally do. All those things can definitely cause some challenges. There's also going to be an impact, or we're already seeing the impact on caregivers. For those of individuals with dementia who maybe live at home, maybe you're a direct caregiver or even a long-distance caregiver. So caregivers are going through changes in work or maybe even your income. Maybe you've lost your job or something like that. Again, with adult day services and other things being closed or being reduced, caregivers are not having as much respite time or breaks for themselves. This is also going to lead to increased agitation or anxiety in those caregivers, in addition to the stress that, was already being felt as a caregiver. There's also a huge concern about the health of yourself, but also others, including the person that you're caring for. So the basic recommendations that we hear all the time that the CDC is recommending is the first main thing is to wear a mask or a face covering if you are going out. So the CDC is recommending that. We're seeing some counties in Tennessee mandating that, like Davidson or Sullivan, like that. But again, it's still being recommended by the CDC that you wear some type of face covering. Of course, practice social distancing whenever you can, maintain 6 feet apart, don't go out more than you need to, things like that. Washing your hands, again, we've all heard this a lot by this point, but it's still really, really important. Some dementia-specific recommendations, the main one would be to have a care plan in place. So we really encourage this for caregivers and individuals with dementia anyway, even before COVID-19. But it's especially important to have a care plan in place for what you would do if you're a caregiver and you get sick, or if the person you're caring for does get sick with COVID-19. How would you continue to make sure that that individual is cared for? And I know our presenters later have some great resources to share as well, care planning, and I would also encourage you to go to cdc.gov in their coronavirus resources. They actually have a toolkit for how to make a care plan for an older adult related to COVID-19. A second thing would be try to keep a routine. So we know that with individuals with dementia, it's really helpful to have a routine. They kind of know what's coming up. And so even if you've experienced a disruption in your routine because of COVID-19, try to create a new routine and just keep to it. And that can really help limit the flare-ups of agitation or restlessness and things like that. You can also find new and fun ways to keep old habits alive. So if you are used to going somewhere and having a group activity, how can you bring that group activity into your home? Or I know I've also seen something online where a man used to take his mother with dementia to the grocery store every week, and that was something that she really enjoyed and looked forward to. And she wasn't able to go to the grocery store anymore, so he would set up all the groceries in the kitchen or the living room, and she would have a basket, and she would be able to essentially go to the grocery store in her home. So something like that, just be creative and think of new ways to do old things. I'm now going to share just a few resources that TCAD has for people with dementia and caregivers. So the first one is new, and it's on our website, tn.gov/aging. It's going to be Caregiver Tip Sheets. These are tip sheets for a variety of different symptoms or things that individuals with dementia and their caregivers experience. This is not COVID-19 specific, but it's still really relevant at this time for caregivers. So we have over 12 or 15 topics like medications, hallucinations, getting lost or wondering, things like that. This is just one example of a caregiver tip sheet about medications. So it gives you a brief introduction, and then it'll say, why does this happen? And it kind of goes through a few things. And the main thing that I like is it says, what can you do? So if you're experiencing medications or whatever the tip sheet's about, it lays out what you can do or the tips that you can use to remedy that issue. Tennessee Care Through Conversation, Jim mentioned earlier, this is a telephone reassurance program for any older adult or caregiver in Tennessee. You can either sign up online, again, at tn.gov/aging, or you can call 615-253-4307 and to sign up for this program. And if you do sign up, you receive a check-in call once a week from a volunteer. You can also request it more than once a week. If you'd like 3 or 5 times a week, that's fine. And on those calls, most of them are just friendly conversations, but we also do a quick needs assessment. So are you able to get your groceries, medications, things like that at this time? And if not, the volunteer lets the TCAD staff know, and we work with our local partners to get those needs addressed. So that's a really good outlet. Lastly, we have a few new programs as well. The Tennessee Cheer Line is a 24/7 line. It's a toll-free that anybody can call and hear a recorded message with cheerful messages, fun facts, trivia, things like that. That number is 833-919-0840. We also have Tennessee Care Messages, which is where you can send a little message to someone in a long-term care facility. You can do that online, again, at tn.gov/aging. Okay, so I just have my information now. Again, my name is Dara Elliott. You can send me an email if you'd like with questions, or type them into the chat bar to the side. My email is just sarah.elliott@tn.gov. Again, that number that Jim shared earlier to call your area agency on aging and disability about services that we offer is 1-888-836-6678. All right, and now we're going to move on to Janice Wade Whitehead with Alzheimer's Tennessee.
I am trying to unmute, and we're going to try to share our slides. Give us just a moment. Okay. I'm with you. I think we hopefully have everything set up so you can see it. I will mention I am having just a little technical moving the slides.
Put the space bar. There you go.
All right. Okay.
Thank you.
So Janice Wade with Alzheimer's Tennessee, and we want to thank TCAD for allowing us to share some of the information and some of the things that we're doing regarding caregivers and also supporting individuals with Alzheimer's. So there is my name and contact information. I want to say that we certainly have been supporting our communities during the pandemic, and Alzheimer's didn't stop, nor was it suspended during the pandemic. So in fact, for many in the Alzheimer's community, their worlds become smaller by experiencing the disease. And certainly during the pandemic, that has been the case. Life has become, in many cases, more complicated, and also the worlds have become smaller. Our helpline is a 24/7 helpline, and you can see there it's 1-800-ALZ-GATE, Gateway to Services. And so our helpline is really a lifeline for many. During this pandemic, helplines have taken a variety of different types of courses. This is Car Talk, in which we call some of our helplines. Some of you may be familiar with the NPR Car Talk show. It kind of reminds me of that, except when individuals and families have been desperate for information. And we've helped people transition into senior communities during this uncertain time. Sometimes they are desperate for a book or brochures. We have met them in the parking lot over and over again to connect them. So it's been just meeting folks certainly where they are. So our local helpline is available during business hours, and you can see by the map there, helplines go into the region where we have an office and staff persons. And then after hours, if you end up, if you're a caregiver or an individual with Alzheimer's and just need to talk at midnight or so, you can call the helpline as well. And then by 8:00 a.m. the next day, those call notes have gone into the local office, and they'll have an opportunity to follow up with you. So last year, Alzheimer's Tennessee assisted 3,437 callers on the helpline, and our calls have increased this last 3 or 4 months. Certainly, they have increased, and so have the intensity of the calls. So it would not surprise me if we exceeded that number of calls that we had last year. Other things that we have been doing is that we have a statewide virtual support group for families. That's on Mondays, and it's a great opportunity for folks to connect with other caregivers. You can see the link there. If you are watching this by video, it's www.alztennessee.org/support-groups. And we've had a great response to the virtual support group. I was talking with an individual a couple of weeks ago, and she was like, you know, I've been on the call, but I've been as quiet as a mouse because my husband becomes paranoid when he hears me talking. So I won't be able to talk, but it really means a lot to me to hear what other caregivers are going through and the strategies that they're using during this time. So it is weekly. A lot of our support groups in the past have been monthly, but our caregivers expressed the need that they needed something to look forward to and really needed that connection weekly. We also have an online Caregiver Academy, and it's available anytime. It's something that we launched a couple of years ago, and it's a 3 to 5 minute long videos. It can be on, people can navigate and look at communication, behaviors, bathing, sundowning, a host of others. Those of you that can see this online can see, once again, our website at alztennesseespelledout.org/academy. This is a partnership that we had with the Middle Tennessee Community Foundation. And I'd like to play just a really short video. I am mindful of our time. A short video. This one is Dr. Monica Crane, and she's talking about diagnosis and what's next.
Diagnosis is very important. Not the best, not necessarily. Non-drug interventions are very powerful and important. Powerful tools like exercise, walking, something that you really how to mind go and calculate lifestyle, not something activities. But also said, well, have to also evaluate drug potential. While there are some other individuals, important that how you perceive the diagnosis.
So that was just a snippet from Dr. Crane, kind of when you get the diagnosis, you know, some people just take that, kind of takes your breath away, but she kind of talks people through as to not only medications, but other things that you can kind of take control of. So we also have created venues for individuals with a diagnosis of Alzheimer's and our online memory cafes. And so it connects individuals who have a diagnosis of early stage Alzheimer's or MCI, mild cognitive impairment, together. It's a wonderful sharing opportunity. That happens online on Tuesdays and Thursdays, so twice a week. It's very, very powerful for individuals who are living with the diagnosis, who have that diagnosis. This is only for the individual with the diagnosis. So it's kind of their safe place to share and to talk and to really hear from others and talk about things that are on their mind. We also, for individuals living with a diagnosis, we have the Live Well with Diagnosis Academy. This was launched April 1. We were anticipating launching it before the pandemic. It's in partnership with the Pat Summit Foundation. And we've had thousands of people have watched it. And I would just say, if you haven't had an opportunity to go to alztennesseespelledout.org/livewell, you may want to do that, in that a lot of us talk about what the symptoms are like with Alzheimer's. We talk about the communication perhaps and behaviors, but really another group of experts are the individuals that have the disease and are living with it. So it's in their own words. And this is Brenda. Brenda has early stage Alzheimer's, and she's just going to give a brief minute or so discussion about the memory cafes.
I'm Brenda, and I think very important to tie into community resources.
and then you're diagnosed with this disease. And one of the first things we did was to get connected with the Memory Cafe with Alzheimer's Tennessee. And the thing about that for me was that it connected me with people who were going through the same problem that I was. There's a lot of people who don't know, like, everyone looks at you and says, oh, you seem fine to me. And so it's very hard to communicate to people who don't have this disease because there's such little understanding about it. So when I got into a community of other people living with disease, I realized that I was not alone.
So that's Brenda, and you know, we can encourage folks to when you know, through our helpline, to utilize memory cafes, but it's also nice for individuals to hear from another person with the disease and that's utilize the memory cafe and what it's meant to her. We've also launched an online enrichment sessions. These are a little bit longer in length and they're 30 to 40 minutes long. We've had, this is for really everyone, relaxation techniques. We've had music therapy. We had a series with a grief counselor talking about grieving in general, but also perhaps grieving the loss of a career, grieving the loss of independence for both the person with diagnosis and the care partner, and just grieving the way maybe life used to be. But one of our popular ones has been chair exercise. The person that on this short clip is Claudia. She leads a chair exercise at one of our senior centers. Of course, they're not open right now, so she had an opportunity to tape this. But this has been just a lot of fun, and we've had a lot of great feedback.
So we're marching a little bit. Now I want you to kick out a little bit. Kick and push out just a little bit. You don't have to kick high. We're warming up the hips still and the knees. Really good.
So Claudette is very friendly, non-intimidating, and we've been surprised how many folks have just really enjoyed the session. You don't have to be ambulatory, so folks have really utilized it a lot in the home. We've had assisted livings. I've also utilized it, and adult daycare centers as well. So once again, all of that can be found under our help menu at alztennessee.org. And since April, our online academies have been viewed over 20,000 times. So it's a great opportunity to connect with individuals, and we've just been really pleased. It's really exceeded our expectation. We do have a series of webinars, and our next one is coming up on Tuesday, July 21st. It's Understanding Benefits from the VA. And we have a representative from the Veterans Administration coming to talk with us. We know that a lot of times understanding VA benefits really is a deal breaker for it allows people to utilize services at home and also in assisted living communities as well. So you can see there Tuesday, July 21st, 10 o'clock Central, 11 o'clock Eastern, and you can go to our website to sign up for that. Lastly, I wanted just to mention our annual Alzheimer's Disease Management and Research Symposium is coming up on August 13th and 14th. This audience is for primary caregivers, primary health physicians and long-term nursing administrators. It's for our professional communities. But if you're caregivers and want to encourage your physicians to participate, usually it's an in-person symposium with close to 250 people in attendance. But this year it's also going to be offered as a webinar. Dr. Daniel Potts is an amazing neurologist. He from Alabama. He really champions life-affirming care for individuals with dementia and their care partners. He's a neurologist, but he's also an artist, so he uses that in communicating with his patients. Dr. Jaka is from the Sandra Brown Center, one of the Alzheimer's disease clinics under NIH, and he will be talking with us about what's in the pipeline with Alzheimer's research. Dr. Ziesel is with the I'm Still Here Foundation. Those of you who are in Middle Tennessee may be familiar with Abe's Garden. He is certainly active with that community and really has shaped a very unique setting, so supportive and really fosters engagement throughout the disease with Alzheimer's. Dr. Davey is the author of a fabulous book called Spectrum of Hope, and it's really looking at, she's a neurologist out of New York City, looking at a different way to diagnose Alzheimer's, and that diagnosing Alzheimer's should be on a spectrum, and it also impacts how individuals are treated. So it really helps to explain why one person with Alzheimer's is often one person with Alzheimer's, and why it expresses itself so differently from one person to another. Once again, primary care physicians, neurologists, long-term care administrators, social workers, and you can see, you can go to our website, alztennessee.org/symposium for more information on that. I want to be mindful of our time, and so once again, Alzheimer's Tennessee, you can see our offices across the state, and we are just happy and want to continue to help individuals, especially during this time. So with that, I will sign off, and just once again, thank you for the opportunity to share. If we have caregivers out there or individuals with a diagnosis, you can always contact one of our offices or go online for additional information. Thank you.
Thank you so much, Janet. All right, so next up, we're going to have Dawn Bunn with the Alzheimer's Association.
Hi, good morning. Thank you so much for inviting us to join today. The work we do alongside TCAD and Alzheimer's Tennessee is so important to the families living with Alzheimer's and other dementias, and our collaboration with the Tennessee Alzheimer's and Related Dementia Advisory Council is so critical to address the needs of the 120,000 Tennesseans living with Alzheimer's and the 444,000 caregivers in Tennessee. Next slide. So the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. And our vision is a world without Alzheimer's and other dementia. Next slide. With the Alzheimer's diagnoses on the rise and challenges presented from COVID, this is an extremely difficult time for not only those with the disease, but other caregivers and supporters too. So the Alzheimer's Association has several resources to help. They're here on the slide, but for those that have called in, we have a 24/7 helpline, 1-800-272-3900, and we'll get more into that in a couple of slides. We also have the COVID-19 and dementia tips for caregivers at www.alz.org/COVID-19. And then of course, we also offer opportunities for virtual support groups and education programs that you can find at www.alz.crf. Thanks, Sarah. Next slide. So please know that the Alzheimer's Association is here for you. through our 24/7 helpline 365 days a year. And through this free service, we have specialists and master's level clinicians that offer confidential support and information to people living with the disease, caregivers, families, and the public. So again, that number is 1-800-272-3900. Contact the helpline day or night to speak confidentially with those master level care consultants for decision-making support, crisis assistance, and education on issues families face every day. You can learn about the symptoms of Alzheimer's and other dementia and find out about our local programs. We also offer general information about legal, financial, and care decisions, as well as treatment options. And we offer, you can receive help in your preferred language through our bilingual staff and translation services. Next slide, Sarah. So as we've talked about, most likely dementia does not increase the risk for COVID-19, just like dementia doesn't increase the risk for flu. However, dementia-related behaviors, increased age, and common health conditions that accompany dementia may increase risk. So, for example, people with Alzheimer's disease and all other dementia may forget to wash their hands or take other recommended precautions. So posting signs throughout the home could really help as those reminders. And so as we moved into March, the Alzheimer's Association produced the COVID-19 tips for dementia caregivers at home. And you can find those again at alz.org/COVID-19. The Alzheimer's Association has also transitioned all of our in-person education programs and support groups to virtual platforms, either by webinar or by phone. And these programs are available to you for free, and you can find more information on the Alzheimer's Association Community Resource Finder. Next slide. The Community Resource Finder can be found visiting communityresourcefinder.org or also alz.org/CRF. And here you can find easy access to many resources, community programs, and services. Next slide. These are our upcoming education programs, just a few of them. These are just this week. So tomorrow from 1 to 2, you can join Understanding and Responding to Dementia-Related Behaviors. And then on Wednesday, July 15th from 12 to 1, we have Legal and Financial Planning with Elder Law Attorney Barbara Moss. And then this Friday, July 17th, you can also join Caregiving and COVID-19 led by Sally Gentry of the Pat Summit Clinic. So again, please visit our website at alz.org/CRF to get a complete listing of all of our education programs and our online support groups. Next slide. ALZ Connected is the association's very active online community for caregivers and people living with dementia. You can browse the forums without creating a profile, and in this way you can learn directly from other caregivers, but you do need to create your own profile to post a message or to ask a question. This can be found at alzconnected.org for those that are on the phone. We also offered the Alzheimer's Navigator. So when facing Alzheimer's disease, there are lots of things to consider. So this Navigator helps guide caregivers to answers by creating a personalized action plan and linking you to information, support, and local resources. So again, this can be found at alzheimersnavigator.org on our website. So thank you to everybody that joined us today. I ran through this pretty quickly to be respectful of time, but we're always here for you if you ever need anything. And we know that one day we will live in a world without Alzheimer's because of all of us together. So thank you so much, and be safe and stay well.
Thank you so much, Dawn, and to all of our presenters today. Now we are able to take questions. If you are online, you can enter a question into the chat to the side. You can select host and presenter to ask your question. If you are on the phone, you should be able to press *6 to unmute yourself and ask a question.
Sarah, it does look like there's one question in the chat. They were asking Janice for the website for the VA benefits, or I think it was at one of their education programs.
Hello, this is Janice. You can go to our website at www.alztennessee.org, and you'll find the webinar posted there. And a link so you can sign up on it for it.
And Janice, this is Larry. It's not up there yet, but it will be later.
Okay.
Thanks so much. Does anybody else have a question you would like to ask before we end the webinar? All right, well, thank you all so much for attending today. Again, if you have any questions, you can feel free to give me an email at sarah.elliott@tn.gov. Also, you can visit our website at tn.gov/aging, and you can also follow us on social media like Facebook and Twitter to stay up to date on events like this and resources in your area. Thank you so much to our presenters, and I hope you all have a great day.
Sarah, this is Janice. One quick question. I've had a couple of people ask if the video is going to live on your website. So I don't know if you had plans, since you were recording it, to make it available.
Yeah, it is being recorded. We'll either post it on our YouTube page or on our website.
Thank you.
Thank you. All right, everyone. Thank you so much.
Thank you. Thanks so much for having us.